Evening, friends. This news summary for May 6, 2026, highlights major breakthroughs in cancer treatment, critical sleep research, and significant regulatory shifts in the United States and India. Breakthroughs in oncology, the pre-surgery short burst. Colorectal cancer milestone, results from a UK-led trial reveal that a short 9-week course of pembrolizumab, immunotherapy, administered before surgery has kept patients cancer-free for nearly 3 years. Precision diagnostics, the FDA has approved the Guardant 360 CDx liquid biopsy as a companion diagnostic for the new drug vepdegestrant. This blood-based test identifies ESR1 mutations in advanced breast cancer, allowing for smarter, non-invasive treatment decisions. Pancreatic cancer access, the FDA issued a safe-to-proceed letter for daraxonrasib, an experimental drug for metastatic pancreatic cancer, allowing patients early access through an expanded protocol. Public health and chronic disease, the cost of inconsistency. Heart attack risks, new research involving thousands of participants indicates that a chaotic sleep schedule in your 40s, specifically inconsistent bedtimes and sleeping less than 7 hours, can double the risk of heart attack later in life. Cervical cancer alert, global health experts warn today that the cervical cancer gap between high and low-income nations will widen significantly without urgent international intervention. Weight loss drug side effects, a new social cost study on GLP-1 drugs like Ozempic found that users may face more social judgment than those who lose weight through traditional means, despite the drug's high efficacy. Regulatory and policy shifts. U.S. Mental Health Policy, Health and Human Services, HHS, Secretary Robert F. Kennedy Jr. initiated a major move to reduce SSRI, antidepressant, use in the U.S. The new policy prioritizes diet, exercise, and therapy as primary treatments, or helps patients transition off medications when appropriate. India's rare disease push, the Union Ministry of Health inaugurated a 2-day national conference on rare diseases in New Delhi. The focus is on early diagnosis and fostering local innovation to manage these high-cost conditions. Device safety, the FDA issued several safety alerts, including reports of an Orivio Infinity migraine device exploding while charging and a recall of certain Omnipod 5 insulin pods. AI and tech in medicine. AI validation, a study published in Nature Machine Intelligence by the University of South Florida, USF, warns that while AI like PanPep can predict immune responses, it still requires heavy real-world testing before it can be trusted for direct patient care. Heart failure innovation, Cytokinetics announced that its drug Mycorrhiza significantly improved cardiovascular fitness in patients with an inherited heart disorder, non-obstructive hypertrophic cardiomyopathy. YouTube video script book and transition ideas. The hook, could 9 weeks of therapy before surgery be the end of colon cancer recurrence? New data says yes. The transition, but while we're curing cancer with immunotherapy, our daily habits might be working against us. If your bedtime is all over the place, your heart might be paying the price. Low iron. Your body relies on iron from foods like meat, tofu, and spinach to help red blood cells pump enough oxygen around your body. Lack of this mineral is called anemia. It can leave you dizzy, weak, pale, and turn your hands cold. Heavy menstrual periods also can lead to anemia. WebMD. Sugar-free cookies. Sorry, but sugar-free doesn't equal carb-free. Some sugar-free cookies have nearly as many carbs per serving as their regular counterparts. Check the nutrition facts label before making your choice. Protein bars. Don't assume that high protein means low carb. Many bars, especially those aimed at athletes who need extra energy, have plenty of both. Need a healthy snack before your workout? A banana with 1 tablespoon of peanut butter might be a better option. WebMD. Call to action. Which of these breakthroughs shocked you the most? Drop a comment down below. Don't forget to hit that like button, subscribe for daily medical updates, and share this video with a friend who loves science. See you next time, and stay healthy. Disclaimer, compiled information. This content is for educational purposes and is not a substitute for professional medical advice. The audience/viewers must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.